Yeah.
Okay, so this is the second video. Dr. Megan is here. It's part 2, and in this video I would like to talk to you and talk to Dr. Megan as well about her fears and frustrations during her exam preparation. So, Dr. Megan, so what was your fear? Did you have any fear?
Well, actually, yes, I did have. The first thing was I heard from other candidates not being able to pass, saying lots of negative things. For example, okay, they don't want us to pass. They want us to, fish them
Steal
with
money from
monies.
you. Yeah.
Yes.
Yeah.
But honestly, no, that's not the case. If you really read with a good mindset, you will realize that this is just for your own learning and your own benefits.
Yep.
And so I try to ignore. That's why I didn't want to be in any group.
Good.
Because
You're surrounded by negative people sometimes.
Yes,
Yeah.
because actually that giving me already lots of negative feelings. So
Yes.
I ignored completely those groups. And so I focused on just studying by myself, role playing.
Yep.
And as I told you, my mindset was to be a good doctor, not
Yes.
to pass the exam.
Yes. So, did you have any other challenges? Because you said you are a full-time mom, you look after 2 kids, in high school, and your husband also is working full-time, so you have to look after, the family.
Yes.
And you started working here 2 months, so it's not easy. It's like doing 3 things. One is full-time study, one is full-time work, like in the clinic, then full-time mom. So, how did you manage all these 3 together? Like more of your mental strength, how did you get it? For example, if it's me, during my exam, I was not married. So, I had no one, no kids, no wife, nothing. I was a free bird. I can study whatever I want. I can do whatever I want. So, I had no pressure. I was working. Yes, it was hectic, but work was in Royal Hobart Hospital in the emergency, and so I loved it because I was crazy guy about OSCEs and exams. So I used to go talk to the patients, love doing role plays. So I was doing that. And I used to think like I'm working and getting paid for doing role plays because that's what my mindset is. But how did you manage this whole family life and work and exam? That's something, that's a good achievement. Not only you, a lot of women over there, I think they're doing the same thing. So I want you to talk about what was your mindset? Have you felt low? Have you felt depressed? Have you felt sad that what the hell am I doing? What was the energy? What was driving you forward? Because it's not easy. It's not easy to do 3 full-time things. What was your motivation? What was your energy that was driving you forward that I have to do this?
Yes, I had lots of problem actually, kids, my family, and apart from that I was actually busy with opera, that.
Paperwork and
paperwork and everything. And my previous supervisor actually refused. Then I had to go through another supervisor to find you and
the doctor.
So apart from those that Dr. Talari mentioned was lots of things, but honestly I looked beyond.
Yeah.
That if I become successful, one day I will look back and I would say that, wow, it was.
You did it, yeah. You should be very proud of yourself. I am proud of you because
Thank you.
of what was happening like 2 days before the exam. I know a lot of people were watching things in videos about, Iran bombing Israel, Israel bombing Iran, and all these things, which is not a good thing anywhere in the world. Having war is not a good thing because a lot of good people die. Yes. And unfortunate thing is your mom was near that one of the bombing site.
Yes,
and
actually
she had serious trauma.
Yeah, my mom, the leg crashed and they had to, like 2 days before the exam, they had to amputate the leg.
Yep.
So I called Dr. Talari and I said, I don't want to go for the exam. I'm really, I'm not in a mood.
Anyone will be, yeah.
Yeah, but Dr. Talari said, anyway, you go. It's not the night before the exam, it's you, if you prepared from the, before, you will be able. So I put all the misery behind And on that day, I just focused on the actually exam.
Yep.
But during this time, actually, be honest, coming to work, I have to drive 1 hour from where I live to where I work.
Yep.
So waking up 5 o'clock in the morning, during the preparing lunch for kids and everything, and then drive back here. During the 1 hour drive, was just role playing by myself or listening to videos, topics about things that
Yep.
one of them, Dr. Talari, actually sent me for about different diseases.
Yep.
And then during when I didn't have patient or had time, just go through things and role play by myself again. And then back home again with kids. But after everyone slept at night, I to stay up late night, like until 2-3 a.m. to study again.
Yep.
Literally the last 2 months before I slept like every night for 3 or 4 hours.
Yeah. See, and you were working, you were doing everything.
Yeah.
You had to drive 1 hour to work and drive 1 hour back home.
Yeah.
So that's very hectic.
But you know what was actually the motivated was just when I passed, then it's looked like you can see the result of all these difficult times.
Yep. No, that's true. That will get rid of everything. So one thing I wanted to ask is, have you done anything extra for mindset and strength, like meditation, or I know you pray.
Yeah.
So means I'm not into religion and things. Every person is the same. We are doctors. Every religion is the same. I like Muslims, I like Christians, I like Hindus. It doesn't matter, but obviously we all believe in God. So what was that strength or the relaxation to the mind? Like sleeping 3-4 hours a night for 60 days is literally impossible. Only machines can do it. Unless you have extreme positive mindset and strength, it's not easy to do that. So have you done some extra practices like meditation or something like that, or praying, or gym, or exercise, or running? What did you do?
No time for exercise, but meditation, like studying for 1 hour, then for 10 minutes doing respiratory, deep respiration.
Breathing exercises.
Yes.
Yep. Yeah, good.
And actually, that was really good. Very good.
To
help me with that. Then to refresh myself, then start, studying. I'm not a person of drinking coffee or anything.
Yep.
Just a tea, and trying to actually. But the strong motivation that was I do as much as I can, not to regret later, and saying that why I didn't do more, I didn't study more.
Yeah.
That was
you
the most.
You put 100% effort into it, and result you can't control. No one knows that who will pass or fail.
Yeah. But I always actually advise, if you feel that you can't go more anywhere, you grab whatever you can to actually extend your strength. If you're going to have taking antidepressant, you do. If you're going to have a stimulation medication, right, Ritalin will help, you do. For exercise, or if even you're going back to your country, near family will help to study.
Mentally to be strong.
Yes, do this, but try to stay positive.
Good.
Yeah.
Excellent. Wonderful. So with this is almost 10 minutes. We will go into the next video if Dr. Megan has got some time. Yes, she has to go home. I can go home a bit late. So we will go into video 3 or part 3 of the interview, and make sure you don't miss this, because medical books don't teach this. And if I do this and teach you all these techniques which she is telling you, I will charge you money. So better use these free things and get better and be a good doctor, be successful, and make lots of money. Australia needs a lot of doctors. Trust me, there is lots of money to be made. So you need to have that positive mindset. Think about future, positive framing, do visualization. If a mother with 2 kids, working full time, sleeping 3 to 4 hours, pass the exam, what are you doing? Okay, so ask yourself, stop showing stupid reasons. I don't have a role player doctor. They didn't give me the exam date when I wanted doctor. This is all rubbish. Okay, so if someone had her mother's legs amputated 2 days before the exam, she smashed the exam, what is stopping you? Ask yourself. So stop being that loser, thinking like a loser mindset. I might sound a bit arrogant guy, but I want to tell people that if she can do it, if you cannot do it, it's shame on you. Okay, so that's why I'm doing this interview. Okay, so is to tell people that if Megan can do it, you can do it. Okay, so don't give silly excuses. All right, so her mother lost her 2 legs 2 days before the exam, so that is the biggest thing any daughter will have. Okay, so if she can do it, you can do it. Be positive. Okay, so let's go into the next video.